Thank you. Yes, Secretary Becerra, I want to talk about rural health because I mentioned in my opening statement a 12 million, it appears as though it's $12 million lower. I understand that our bill funded it at 364.6 million, which is rural outreach, rural hospital flexibility, and other things. The request is for 352, which is lower, 12.2 lower than what we actually funded this for. I understand also that the budget release and then the timing of the actual passing of the budget were almost at the exact same time. Might not have been ideal for you. What would you say about that? Healthcare delivery systems in rural America are still very difficult and underfunded. We have the lowest life expectancies in rural America. What's your response to that?
Senator, you actually touched on probably the most important aspect of my answer, and that is that our budget was being framed at a time when we had no idea what the 2024 budget would look like, and because of the constraints on where we could go, we had to make sure we tried to be consistent with what might come out. So we are more than willing to work with you on the kinds of investments we would make in healthcare generally, but more specifically with regard to rural health. You will find that there are specific investments in rural health, especially in the area of substance use disorders, in trying to keep hospitals afloat, that we can work on to build on, because I think you're right. There's no doubt that it's tougher if you're in a rural community to find a healthcare facility near you. And so we'll do everything we can to try to keep not just them sustained, but also to have them thrive.
Well, we'll work on that and understanding the circumstances of when your budget came out.
Yeah.
I did have a lot of questions on drug abuse and SAMHSA, prevention and harm reduction. Here's the discouraging thing. These statistics are not coming down. I mean, the overdose statistics, I heard on the radio the other day that the statistics in DC alone were up, I don't know, 20, 30%, deaths resulting from overdose. We don't have, I don't think we have the statistics quite yet for this past year. We've got a flow of fentanyl coming up through the southern border. We got to do better here. I mean, we are losing a generation. And I understand in your last answer some of the areas, you know, fentanyl strips and naloxone, but that's still just treating somebody who's already in heavy addiction. I mean, I think the prevention aspects of it have not gotten to the younger children as much as they should. We got to start kindergarten. What's your response to that?
With you, completely with you on that. Here's the difficulty. As you know, at the federal level, the Department of Health and Human Services, we don't administer these programs. We work with the states. The states are the ones that have control over healthcare and this aspect of healthcare. What we do is essentially provide them with more resources, or we give them some support and flexibility in doing what they can with the dollars that we give them. We are more than willing to work with the states to increase their capacities. They need more capacity.
What states are doing it? I mean, I'm sure you're looking at what the innovative programs of a state that might be able to be shared nationally. I'm sure that's best practices that you're pursuing here on the prevention side.
Oregon, as you know, had an issue with increasing drug use. And what they have done, when I've been to visit, I've seen how they are incorporating young people into their programs to try to get them to become essentially peer support, so that peer-to-peer kids are hearing from someone who can help them out. Obviously getting the adult and professional help as well, but we need to try to reach young people, to your point, before they become users. And so there's where we gotta figure out a way to capture them quickly. And I think Oregon is doing a pretty good job of trying to use young folks to help them approach that cohort.
Well, coming from a state that doesn't have legalization of recreational marijuana, I think that's an example of where some of the issues may be. I know there's a lot of people that believe that's a good thing to do. I personally am not one of them. Quickly, on the suicide prevention line, you've asked for a lot more money here. We've provided a fourfold increase in fiscal year 2023. You're requesting $100 million more for 2025. I'm wondering, can you give me a breakdown? You might not have that right now, but how is this breaking out to, is it going out the door to state and local crisis centers versus a contractor that's administering the system? I'd just like some more details on this request, given the sensitive nature of the program and the critical work they do.
Certainly, and we can follow up with your staff to give you more of the details because those are out there. Most of the money helps sustain the state operation, the call centers that already existed. We essentially have buoyed them because we established backup call centers because a lot of the states didn't have the capacity to deal with all the calls that might come in. We didn't want people waiting on the phone
No.
with a busy signal.
Yeah.
So we stood up all the backup call centers. We also made specialty lines. So, for example, if you're a veteran, there's a line that's
Right.
specific for you. Those are the things that the federal dollars have really helped boost. We also helped create the text and chat feature so that if you didn't want a phone
Is that
call,
online now, the text and chat feature?
yeah, absolutely it is.
Okay.
Absolutely. It's available now for hearing impaired. It's available in some places, Spanish language. We're trying to make sure no one feels like they should not call. And now you hear that we're going to finally get to the point where we can make the 988 call work so that wherever you are, whatever your area code is, you're going to get a professional where you happen to be, not based on your area code. It's working. The $600 million that is in the president's budget for 988 is absolutely going to save lives. We know that in the first 18 months of launching National 988, 1.5 million people reached out to us and said, help. We were able to answer.
Thank you.